that this is a virus that has been injected into our community, if you will. Jerome, you work on the streets with the kids on a daily basis, with adults on a daily basis. What are people telling you about HIV and AIDS, and what are the behaviors that are causing this 60% number?
I think that's the part of the biggest problem, is getting people to change their behaviors. You have a lot of people that don't like to wear condoms, or families don't allow condoms. And the behavior issue is the biggest thing. They don't, the trust, like she said, of the healthcare providers. And
talk to me a little bit more specifically about this trust issue. Is it that that the healthcare provider is going to, tell their boss or tell their family, or what is the trust factor? What exactly is that?
It's hard to get to the root of who, when they say trust, but in doing testing, because that is part of the job that I do, is testing. We ask various questions, and they're reserved to give a lot of information, personal information about themselves, or sometimes they give misinformation. And we have to, go about other ways to hunt these people down or find partners and that type of thing. So it is a lot of misleading information, but mostly it's just the behaviors. It's the biggest problem.
So Hildegard, from Planned Parenthood's perspective, you all are trying to teach safe sex practices. People are not following that.
Well, when you look at the young people, especially the age group that I work with now, they're 11 to about 14 years old. If you're a young lady and you use or you have a condom, then quote unquote, somebody thinks you're nasty or you're dirty. And young guys believe that you're saying something negative about them if you ask them to use a condom. So what happens is, this is my boyfriend, I'm his wifey, and I'm not a shorty. That means shorties are girls that...
Shorties are girls that are on the side.
The sideline girl. I'm the wifey. I don't do that. And, long-term committed relationships, when you start talking about that to a 13-year-old in middle school, a long-term committed relationship runs football season. And after that, it's a basketball player. And after that, it's somebody running track, and then it's somebody for being at home in the summer. So you're talking about on the average of 4 long-term committed relationships in the school year.
And these girls are sexually active, and women, they're finding are dying in higher numbers, and because they're contracting HIV and AIDS from this type of behavior.
Well, what happens with that is, because of the health disparities, economics, in the household, the first person that you see for a health issue is the mama, the grandmama. Well, you're not going and telling them that something is wrong with you down there, quote unquote, down there, like we're talking about somewhere in Australia. That's not a conversation. So what happens is they end up with a piggyback infection, such as syphilis or herpes, that causes a lesion that makes it more, the body ready.
More accessible.
That's right, the body can be more infected openly with HIV. But with syphilis, the sore goes away with no treatment. So, quote unquote, I'm all right. That's what happens with it. And so you don't go to the doctor until it's a necessity. And you're not going into a clinic with a Medicaid card because the government will know, and they may cut off my mama's money.
Let's get some definitions going for a minute. HIV is
HIV is a virus, and it affects a person. It is not. It can cause AIDS. There are different definitions of AIDS, but with the there is a count that we use to follow the disease called a CD4 count, and when that is below 200, then you have a definition of AIDS. And the other characteristics that can occur with the AIDS diagnosis. But what we're trying to do now is, once we find out that a patient is HIV positive, then we follow these parameters, and they never become an AIDS patient.
An AIDS patient, because we're able now. Someone described it earlier to me as it's now classified more as a chronic disease, HIV infection. like diabetes and like where you have it, you can't cure it, but you can live with it.
Right, and that's why I think one of the reasons is that we are not talking about it as much, because it has become a chronic disease, and that's why the funding is drying up as well. Another significant factor is because 60% of the patients now being diagnosed are African Americans.
So Jerome, what would you tell,